Hi, Shauna.
Oh, hi. I was about to ask for your help. My patient was admitted with heart failure. He's been on furosemide 40 milligrams. He takes it once a day orally at home, but he's receiving it intravenously here in the hospital.
Is he receiving fluids through his IV access?
No, it's a capped medication lock.
That makes sense. We wouldn't want to give a patient with heart failure extra fluids, which could make the condition worse. What can you tell me about a saline lock?
A medication or drug infusion lock, also known as an intermittent peripheral venous access device or saline lock, is used for patients who need intermittent intravenous medication.
Good. The device is kept patent by flushing it with small amounts of saline, which is pushed through the device on a routine basis. We used to routinely flush with a heparin-based flush, but this practice is no longer recommended for peripheral IVs. The saline lock is flushed before the infusion is started and after the infusion is completed. Why is that?
To clear the vein of any medication and to prevent a clot from forming in the catheter.
Good. And at this point, you want to verify the recommended infusion rate for this particular medication. What else do you know about this medication?
I've also reviewed the class, action, special nursing considerations, safe dosage ranges, why the treatment is being given to this particular patient, and any possible adverse effects. I checked the medication order against the original order in the health record. I noted that there are no inconsistencies and there are no allergy concerns. I looked up furosemide. The patient's potassium level is within normal limits, and the medication will be administered slowly over 2 minutes, 20 milligrams per minute.
Very good.
Thanks. The nurse just helped me gather my supplies. We performed the first medication check when we pulled the medication from the dispensing system.
I can see you've done the first of the 3 checks and gone over the rights of medication administration.
Every step.
While you have the MAR open on the EHR, I'd like to double check the medication before we enter the patient's room.
Sure. The medication matches the EHR. This will be my second check.
Good. Before we administer the medication, you must also confirm IV placement according to hospital policy. This is done by assessment of the site, observing for blood return, and flushing with saline. Keep in mind that Mr. Phillips has a peripheral saline lock. If he had a central line or other central venous access device, we would need to review the hospital policy for flush and medication administration procedures. They may be a bit different.
Right, I remember reading that.
Okay, let's go see your patient and administer the medication.
Mr. Phillips, hi, I'm Shauna, the nursing student that was with you today. I was in earlier.
You and everybody else.
Well, it does get hectic sometimes. I'll try to give you some alone time as soon as we're done, okay?
All right.
This is Miss Nosek, my instructor.
Okay.
We're here to give you some furosemide.
Oh, that's great. I'm used to taking it in the morning at home as well.
Okay. May I see your ID band?
Sure.
Can you tell me your first name, last name, and date of birth?
Peter Clayton Phillips, January 25th, 1983.
Great. I noticed that you don't have an allergy bracelet on. Do you have any allergies?
No allergies.
Well, that's good. I'm going to be giving you medication through your IV. You mentioned that you take furosemide at home. Do you have any questions about the medication?
No, I know furosemide. I take it every day. I guess I'll be back on pill form when I get out of here.
Yes, as your condition improves, they'll likely switch it back to pill form. We're going to step away for just one moment and prepare the medication.
Well, we already checked the medication label twice. I have the right patient, I have the right medication, I have the right route, and I have the right time. It's 0900, and I have the right dose. The medication comes in 10 milligrams per milliliter, so I'm going to need to draw up 4 milliliters to make 40 milligrams.
Good job. Now let's do the third check.
Okay, I'm going to look at the vial one more time and verify it against the MAR. And I have the correct volume in my syringe, and I'm all set.
All right, good. Now let's check and flush the IV site. Remember, when we check the IV site, we want to look for any presence of inflammation, infiltration, swelling, coolness, any leakage of fluids around the IV site, or pain.
I will. Mr. Phillips, I'm just going to raise the bed for me, okay?
All right.
I'm just going to place this underneath your arm. Okay, Mr. Phillips, I'm just going to have a look at your IV site. How's it feel?
About as good as it looks.
It looks good. Does it hurt or is it sore?
No, it's fine. I just don't like having it.
Well, it doesn't have any swelling, altered temperature, or leaking, so it's good to use.
Okay. So talk me through the process, Shauna. But remember, flush with saline, administer the medication, then flush with saline. We call this process SAS. Saline, administration, saline. All right, so start by removing the antimicrobial cap.
You feel a little tug on this tape.
Then stabilize the port with your non-dominant hand as you insert the syringe with normal saline. All right, and aspirate gently and check for blood return.
Okay, I see it. Now, I gently flush about 3 milliliters of normal saline by pushing slowly on the plunger. This is a standard flush at this hospital. I know I can have more saline in the syringe than I need. That actually helps to make sure there's no air injected.
Observe the insertion site while administering the saline. Puffiness or swelling around the site during flushing could indicate infiltration of the catheter site.
Now it looks unchanged and there's no resistance. Okay, now I remove the saline syringe and I scrub the access port for 30 seconds and wait for it to dry. Now that the port is dry, I'll insert the syringe and gently inject Mr. Phillips's medications. I'll use my watch to verify the correct administration rate, which in this case is 2 minutes. To make it easier to track, I'm going to inject 1 milliliter every 30 seconds.
Excellent, Shauna. That is the correct rate. IV medications must be infused or pushed at their specific recommended rate, otherwise there might be complications.
Good to know.
And remember, Shauna, never force injections if you feel resistance, because a clot could break away and cause a blockage somewhere in the body.
Right. Okay, now I'll remove the medication syringe from the port. As I do that, I will stabilize the port with my non-dominant hand. Now I'm going to disinfect the access port again before I go on to the next step. The port is dry, so I'll insert a second syringe of normal saline.
Good. Now gently flush the saline by pushing slowly on the syringe plunger. You want to flush slowly because there is still medicine in the extension tubing, and you don't want to administer it faster than you administered the rest of the medication.
Okay, the line has been flushed.
Good. Now, remove the syringe and clamp the tubing. Then scrub the port for another 30 seconds and attach a passive disinfection cap. Now, Shauna, if there were no positive pressure valve on the infusion lock, you would clamp the IV tubing as you were still flushing the last of the saline into the medication lock. Then you would remove the syringe.
Right, they went over that in class. Okay, I'll evaluate the patient's response to the medication within the appropriate time frame.
Correct. And in this case, we'll be keeping track of his urine output, and we should check the IV site at least every 8 hours or so to ensure the patency of the system.
Right. Mr. Phillips, don't forget to use the urinal.
Got it right here.
Okay, Mr. Phillips, I'll leave you alone for a bit. Do you need anything before we go?
No, thank you.
Thank you. And good work, Shauna. Remember to document the medication administration, and then I'll check it.
Thank you, I will.